Hello, Dr. Pickett and Mr. Hooker. This is Allison Lamb with Poly Extract, a medical device to be used during a hip replacement surgery. I am meeting with Dr. Gaskins, who is an orthopedic surgeon. I was in her office talking to another surgeon, and I caught her in the hallway, so she is meeting with me. She's heard about my device, but I'm going to explain it to her now. Okay. Hello, Dr. Gaskins. I am Allison Lamb with Poly Extract, a medical device to be used during a hip replacement surgery. As a biomedical engineering student, I worked with my design group and Greenville orthopedic surgeons to develop a device to be used during a liner exchange surgery to make the surgery less frustrating and more efficient for you and your operating room nurses. Today, I would like to sit down and ask you a few questions about your surgeries and see if you have any problems.
I actually have a surgery in about 30 minutes, so I don't really have time at the moment.
I understand you're busy. A lot of surgeons I work with are very busy with their schedules as well. But they did schedule time, and they found that I was able to provide medical devices that make their surgeries run more effectively. I would just like to sit down with you, you think about your problems, and we can discuss your surgeries, and maybe you can think of some problems and issues that you have that I have a solution, I have a medical device for.
I do have many frustrations. I'm more busy next week than I am now, so I'll probably can take a few minutes out and sit down and talk right now.
Great. So, Dr. Gaskins, tell me a little bit about yourself. How long have you worked at this hospital?
I've been here for over 5 years. I came to Greenville for my residency, and I loved it so much I just decided to stay.
Yeah. What do you like about Greenville?
Oh God, well, I love the people and everything about the upstate in general, I guess. I really enjoy the hospital system and the staff.
Yeah.
And all of my patients are very active about wanting to make their lives better.
Right.
So yeah, I really, really like Greenville a lot.
Oh, good. I love Greenville as well. It's just so active, and you have people who really, really want to make themselves better.
Yeah.
So, as an orthopedic surgeon, some orthopedic surgeons specialize, and some just do everything. What types of surgeries do you perform?
Well, I do surgeries for any orthopedic emergency, really. But I do specialize in hip and knee replacements. Meaning, those are my main focus.
Right, exactly. Well, could you please describe your hip replacement surgeries to me? Specifically, how do you get the ultra-high molecular weight polyethylene liner out?
Well, first I cut the skin and the muscles until I, see the bones. I have to use retractors to hold back the skin, the fat and the muscle, so I can have a larger viewing area. If the patient and the x-rays show that only the liner needs to be extracted, then I can use an osteotome, which is just a stainless steel medical tool that I use to pry under the lid of the plastic liner. I just put force on it and try to get the liner to pop out.
Okay. I worked in a research lab in my undergraduate and implant retrieval lab. We used to collect implants that had been taken out of patients. And I saw that so many of these liners are damaged, either while in the body or during the extraction. And it seems like sometimes the osteotome would never work. So, do you ever see liners that you cannot use with the osteotome, and how do you get them out?
It actually happens more often than I would like. The osteotome, just won't work, and so then in that case, we have to go to Plan B or even Plan C. It can be a lot more time consuming for sure, and it means more work for my nurses. I'll use the screw method.
Oh, the screw method. Well, would you please describe how you use the screw?
Oh yeah. Well, it takes a lot more tools than just the simple osteotome for sure. First I use a drill bit to make a hole in the liner. Then I grab a drill and a screw. I put the screw in the hole, and then I use the drill to, drill the screw in. It'll go through the plastic liner and will stop when the screw hits the medical cup, or the metal cup. Since the screw has no other place to go, the liner just rides up the screw, and then I can just pull it out.
Okay. One of the surgeons I worked with when working with devices was Dr. Pace, and he uses a similar screw method. But he said that when he goes to conferences, and even some Greenville orthopedic surgeons, he's found that they do not know how to use the screw method. Do you know anyone who doesn't? And
Well,
how do they get figured out?
a lot of people don't like to use the screw method because it does take so many parts, and it's a lot more expensive than a simple osteotome for sure. Also, it's a little risky, you know.
Right.
So a lot of people just choose not to. One of my partners actually doesn't use the screw method at all. When he can't get the liner popped out, he either resorts to a total hip replacement
Oh.
or he'll call me, and I have to, you know, leave my own room and and go over and help him out. So
That must cause a lot of commotion for you and all of the nurses, moving rooms. Well, where do you get the screw and the drill bit?
I just grab whatever screw is around. You know, time is of the essence. Usually that would be a titanium bone screw. These go for, you know, $400 or so dollars, which is pretty expensive for the patient for sure. I just don't have time to waste running back and forth trying to find cheaper screws. The sad thing is that, you know, you have to throw away all these materials after. It's waste. So sometimes the tools are there when I need them. Other times the osteotome doesn't work. I have to send my nurses. It's an ordeal.
Oh my. So if I understand this correctly, you seem to waste a lot of time if your first tool does not work. Then in that case, you have to go and grab more tools for just this one, what should be a simple surgery. And the screw method has so many steps that may prevent you as the surgeons from being able to perform this type of surgery. What would be the most important concern you have? What keeps you up at night?
You sum that up very well. I would say that my main concern is definitely wasting time. I have a full schedule every day. I don't really have a lot of extra time to waste. Also on the patient side, you know, the longer that the patient is under anesthesia, the greater the chance for them to develop life-threatening problems. So I need something that's simple to understand and use for my nurse's sake. Something that doesn't have very many components, like the screws and the drits and the drills and the bits and all that. My nurses hand me every tool that I use as well. So if something falls in passing, then it's only wasting time and money because, you know, it's no longer sterilized. So my nurses have to go out and get another tool, and it's more time consuming. So those are my main concerns.
Okay, Dr. Gaskin, I understand your needs. Do you have any other concerns?
Well, you know, I'm always looking for ways to save money with, you know, the economy and the healthcare system, the hospital. It's always making me think of what I can do to cut costs.
Right. I'm glad you brought that up. So really, your four main concerns are saving money, saving time, decreasing the amount of tools, and making your tools easier for your nurses. Now, bringing up the money, is saving time still your main concern?
Yes, absolutely. Time first because, yeah, as they say, time is money. And I am always rushed for time. Then, you know, I'd like to use as few tools as possible. And then probably, you know, decreasing the number of devices that would ultimately help save on medical costs.
You are right. Can you think of any other concerns?
No, not at this point.
Well, great. That is why I am here. I have a medical device, the Poly Extract, that acts in a way similar to the screw method. However, it's all the components are right there, and it's only 3 components. You do not have to use a drill bit or a drill. It's a hand tool, which is great, so then you can actually feel what you're working with. Sometimes sometimes some surgeons have found that the drill, they cannot feel when they actually hit the metal cup, and they have scratched the metal cup, and then they have to replace all of the components because that's the problem.
Absolutely.
So this tool we have, it's just 3 components. The first is just a pin, and it acts as a guide and an anchor, so you do not have to make a hole and then pull it out and then put the screw back in. You just leave this guide pin in, and then you have your screw, and there's a handle. You're just going to turn it until it hits the metal cup. You'll feel that, and then the liner will ride out the screw, and you can pull it out. and then everything's right there, your surgery's done, and you can replace that liner and then get on. It's just, the poly extract is great. It's worked really well for surgeons because it's their plan A. They don't ever have to think of a plan B. You can use it in any part of the liner. You do not have to use the osteotome. You can just use this as your first and only tool to use. And with that, it helps save time. You can go ahead and get it out. I know you probably do not want to be wasting any more time than you have to.
Absolutely not.
And it's great because all the components connect together, so your nurses do not have to worry about accidentally dropping a piece if it comes apart and then having to run out since a piece has become unsterilized. This is great because you can get in and out. It's going to make your nurses love the surgery even better, and it'll be wonderful for the patients and the families who are waiting and who would rather have a shorter surgery rather than a longer one.
Definitely, this tool sounds like something that I would absolutely use. Do you have a prototype with you today?
Yes, I do. Let me show you the tool. Here it is, and I'll also show you a brochure so that you can actually play around with it and see how it works.
Okay, great. So is there any chance that you could help my nurses learn how to use this tool?
Absolutely. Your nurses can come into the training with you, and I'll always be there for them. This tool really, it saves time. It's going to decrease the number of tools that you have to use. It's going to make your tools easier, and it's also going to save money. Do you see any reason that you should not be using the poly extract for your patients?
No, I would like to purchase this device. My nurses will certainly be thrilled to hear about it. I would like to use it on a trial basis, make sure it works properly.
Okay, great. Well, these are the next steps. We will schedule a meeting next week, a time to go to the cadaver lab and actually practice in a body. And I'll bring all the tools, I'll bring all the boxes. Your nurses can come with us so they can see it. They can even try it themselves and to see how it works. And then I will be there in your surgeries. I can help you out. I'll always be here for you. You'll have my phone number and my email and my contact. And so if you ever have a problem, please just call me first because I'd like to go ahead and help you right immediately. This tool, we are here for you. We want to make your surgeries the best they can be.
Well, I'm excited already. Anything that'll save me from plan B and, drilling and taking out an entire hip that doesn't need to be taken out, it sounds like a great opportunity for me.
Great. Well, thank you, Dr. Gaskins. I'm very excited to work with you.
Okay, yeah, me too. Thank you so much, Allison.